We're back now with a troubling trend in the fight against this so-called triple-demic.
Cold and flu medicine like Tylenol and Motrin are in short supply because of surging cases of respiratory illnesses and COVID. It comes as the brunt of flu season is just getting started. Joining us now to discuss is NBC News medical fellow Dr. Akshay Syal. Doctor, good to have you with us. I mean, clearly this is concerning. I mean, how concerning is this?
Well, it is concerning, and it's a little bit reminiscent of, the toilet paper shortages that we saw when the pandemic first hit. You're seeing people tweet photos of empty shelves or going to look for cold medicines, and they can't find it. But the reason this is concerning, though, is because, flu doesn't typically peak until December to February. So we're not exactly at the peak of flu, and we're seeing indications that COVID is starting to come back a little bit. So we're not exactly at the peak of these viruses, and already we have a shortage, and that's where a lot of the concern is.
And I know some of this concern is also with particularly the dosages that are recommended for children. What do parents need to know in order to keep their kids safe if they are seeing these empty shelves at their stores?
Yeah, I think a lot of that is because of the triple-demic that we're always talking about, right? RSV, COVID, and flu tends to hit kids pretty bad. And so, what parents can do is there are other forms of medications they can try. So children, tend to have liquid Tylenol or liquid ibuprofen, and there's chewables you can try. But if your kid's a little bit older, take this as an opportunity to try to get them to swallow medications. Kids typically learn about the ages of 5 to 10. I know I was definitely on the older side when I finally learned how to swallow medication, but this is a good chance to try to teach them that as well.
What type of strain does this put on healthcare providers?
Well, so a lot of the issue is people visit their healthcare providers because they have a fever and because they can't break it. And if you don't have that medication, that tool at home to try to bring that fever down, the worry is that this will start to flood urgent cares, flood emergency rooms, flood pediatrician offices with people who just can't bring the fever down and who are concerned about that. And that's really where the concern is.
All right, Dr. Akshay Syal, thanks so much for joining us. Yeah. We appreciate it.
Great to have you with us.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.